Today, we're talking about a diagnosis that is often missed for years, Sheehan syndrome, a form of hypopituitarism that occurs after severe postpartum hemorrhage. We will also discuss two real-life cases that demonstrate how easily central hypothyroidism can be overlooked and how the correct interpretation of thyroid labs can save lives. Sheehan syndrome is relatively common in low and middle-income countries due to higher rates of obstetric hemorrhage, yet it is frequently overlooked or missed. What makes it tricky is the slow, subtle presentation often mistaken for anemia, depression, or just normal postpartum changes. Central hypothyroidism may be the first biochemical clue, but TSH is often normal or low, so routine screening can miss it entirely. Let's look at case 1. A woman in her third decade, with a history of postpartum hemorrhage 8 years earlier, presented with long-standing fatigue and secondary amenorrhea. Her thyroid function tests were as follows. This pattern, low T3 and T4 with a normal TSH, is classic for central hypothyroidism. This is why relying on TSH alone would have missed the diagnosis. Further evaluation revealed low cortisol, low gonadotropins, and low prolactin, confirming panhypopituitarism. MRI pituitary showed a complete empty cella, consistent with Sheehan syndrome. Now, case 2 highlights a different risk, one that can worsen the patient's condition if missed. Again, low T3 and T4 with a normal TSH. But here's the danger. This patient was started on levothyroxine without checking adrenal function. Her symptoms worsened because levothyroxine increases the metabolic clearance of cortisol. If the patient has underlying adrenal insufficiency, which she did, this can precipitate adrenal crisis. So what should have been done? Always evaluate the HPA axis first in suspected central hypothyroidism. In both patients, glucocorticoids were initiated before levothyroxine. After stabilization, hormone replacement was optimized and both patients improved significantly. TSH alone is not enough. Low T3 and T4 with a normal TSH should prompt evaluation for central hypothyroidism. Think of Sheehan syndrome in women with previous postpartum hemorrhage and unexplained anemia, hyponatremia, hypoglycemia, and/or hypotension. Always check adrenal function before starting levothyroxine to avoid precipitating adrenal crisis. MRI and full pituitary panel confirm the diagnosis. Sheehan syndrome is underdiagnosed, but with awareness, careful interpretation of thyroid function tests, and correct sequencing of hormone replacement, clinicians can prevent years of suffering and life-threatening complications. If you found this helpful, don't forget to like, share, and subscribe.